very nice that everybody took the time to be here this morning. Welcome to Milford Regional. My name is Frank Saber. I'm the Chief Executive Officer here at the Medical Center, and we're very pleased to have all of you with us this morning, and we're very excited about this particular project that we're going to talk about in some detail momentarily. I particularly want to thank Congressman Kennedy and his staff, and Senator Moore and his folks, and Representative Durant and his crew for being with us this morning, as well as the folks from the Mass Tech Collaborative and the eHealth Institute. This is a wonderful project, and as I think about healthcare reform, other than the need for the best providers you can possibly have working with you, both physicians and hospitals and other providers, perhaps the most critical component of successful healthcare reform is having effective information systems. Unfortunately, it happens to be one of the most complicated components of healthcare reform as well, as many of the doctors and nurses and other providers would attest to in terms of how difficult it can be sometimes to connect systems and make things work. But we are delighted that we have these partners now with Medway Country Manor and Care Tenders as well, trying to work on simplifying the transfer of electronic information between our hospital and those post-acute care providers. We think it's a great way to improve care. We look forward to working with those folks and others to implement these kind of systems, and we're grateful to the folks at Mass Tech and MeHI Health for allowing us these grants to put these programs in place. And with that, again, thank you for coming. I'd like to introduce Lawrence Stutz from eHealth Institute.
Thank you very much, Frank, and thanks for the warm welcome, and welcome to the representatives and Representative Kennedy and Senator Moore and Representative Durant. I'm the director, as Frank mentioned, at the Massey Health Institute at the Mass Tech Collaborative. MeHI is the state agency responsible for helping with health information technology adoption, and the legislature has seen fit to recently in Chapter 224 re-up with us to help with the implementation of the health reform bill and the continuing Massachusetts journey on health reform. So we're really excited to be here because this is a piece of the last mile program, the health information exchange. As we go from educating providers to getting providers to have digital health records, electronic health records. In Massachusetts, we're leading the country in that area. Over 90% of our hospitals and over 70% of our physicians are using electronic health records. Now we have to start moving that data around. We have to start moving it from here at Milford Community to the home health agencies and to the nursing homes that serve your community, so that we can share that information securely and that we can share it very efficiently, so that we don't have any patients whose information gets dropped through the cracks because of old and outdated paper processes. So this is actually there's two grants that we're talking about today. I think there's 10 different organizations that are involved with this program, and this is just 2 out of 32 grants across the state that are all part of these implementation grants that are really starting to transform the way that all of us get health care. So I'm excited and honored to be part of that and leading the eHealth Institute. We'll hear in more detail from each of the grantees and from the organizations who are really going to be doing the work. We're just here to sort of help support them and help move them along. With that, I'd like to introduce my boss, CEO of Mass Tech Collaborative, Pamela Goldberg.
Thank you, Lawrence. And it's really exciting to be here today. We've been working on electronic health records now for several years, and we were fortunate enough to get some federal funds to kick things off, and now here we are, not just getting folks to have electronic health records, but actually using those records to implement connections to the statewide health information exchange. So it's very exciting to be here today. I believe that e-health is the next big wave for the Commonwealth of Massachusetts. I think that Massachusetts has seen healthcare drive a number of initiatives. Our life science industry, biotech, have been leaders for the country. I think e-health is the next wave, and projects like the one that we're celebrating today is part of that story. And I really look forward to seeing the results of the efforts that come from this grant and other grants like this, and making Massachusetts a symbol to the rest of the country of what can be done, what should be done, and where we'll be. So I would also like to mention Congressman Kennedy for his work in Washington on our behalf, and to Representative Durant, but most importantly, Senator Moore, who had the vision to realize how important e-health would be for the Commonwealth and what kind of difference we could make by putting some state funds to work to help all the hospitals and healthcare providers across the state adopt electronic health records. So what a remarkable vision is becoming realized for all of us, thanks to Senator Moore's ideas and innovation and vision on our behalf, and how fortunate we are at Mass Tech and MeHI to have the opportunity to work with institutions like this one to make those a reality. And so I'd like to introduce Senator Moore. He's serving his 9th term, representing 14 towns in the Worcester-Norfolk district, including this one. He is in the senior leadership in the Senate and is currently serving as Senator President Pro Tempore. Please welcome Senator Moore.
Thanks very much, family. I need to be a little taller, I think. Frank, fix this. I don't know, this doesn't, I can split the spotlight on all of you. So this is very fortunate. It's, the reason this is set up this way is it's well known to the local folks that, that Frank Saber is a noted actor, not only here at the hospital, but actually, well, that's what Ed told me. But actually on the stage as well, but not yet screen. But we'll get you there, I think too. This really is a very exciting day. It's, you know, when Joe and Peter and I pass legislation or approve budgets and things, it's nice that we do it. But seeing how it plays out and how it really helps people and helps to, in this case, to improve the transparency of healthcare, to make it more understandable, hopefully, to not only the patients but to the providers themselves, as to what sometimes the consequences of their work might be, or the consequences when they make a mistake could be. It will certainly improve safety for the patients, and that will also be a factor in helping to contain costs of care. Will improve the quality also, because the focus ought to be on making people well or keeping them well, not simply trying to find more expensive ways to deliver the care, but to utilize technology to make it more efficient and be more helpful. So the grants. The interesting part of the grants is that you know, Joe Kennedy has done an outstanding job. In less than 7 months, he's provided millions of dollars and vision for the healthcare reform in the country. None of us could have started with that kind of an advance, but since it's in the genes, I think, in the Kennedy family, that he was able to do that. But the federal money that was made available, actually some of it through the Stimulus Act, some of it through health reform, and through a couple of other vehicles at the federal level, really helped the larger providers for the most part. Many of them, you know, if you're a Mass General or a Partners, you already have some money. Of course, you always want more, but and if you can get it from the federal government, so much the better. But they can do their connections and do their development. But it's really at the community level, at the physician office level, at the skilled nursing facility and the home care level, all of the end users really, of the end deliverers of healthcare and the end users of this system, where the benefit will really be the most significant. Because it's, it's so important that, for instance, a hospital, because they'll also perhaps be charged more if they receive less reimbursement, if somebody goes back to the hospital. When you're discharging somebody to rehab, you want to make sure that the folks at the other end who are going to take care of that rehab, whether it's in a skilled nursing facility or in the home or wherever it may be, that those providers also have appropriate access to the information about the patient, so they can make sure that all of the requirements to make sure that transition is seamless and really smooth, and that it's for the benefit of the patient. So this particular part of the grant, in which the state felt it important to really step in and provide money, frankly, through the help of the healthcare providers and the healthcare insurers and others, through an assessment that we put in Chapter 224, to provide the resources to the end users of the health information highway, the folks at the street corner, street level, I guess, of the highway, to be able to make sure that they had the resources, because it does cost some money for the equipment, for the software, for the time it takes to redesign your business plan, so that you can accommodate this within the delivery of care. And it's one that I think is going to be critical, and as Pamela has said, this is really the next stage in healthcare reform, to make sure that everybody is not only has a patient electronic record, but that providers, wherever they might be, can have use for it. If somebody from Milford travels to the Cape, or they travel ultimately to some other part of the country, and they have a health emergency, whether it's an accident or some kind of physical health problem, that it's important for the providers at the scene to know something about what are their allergies, what kind of medications are they taking, what has been their health status. And that way, one is you save a lot of time and money in the testing and things that you have to do to figure out what's going on here with that particular patient. And so it will really be a significant benefit as we can have the interoperable nature of this system fully implemented. And we already have shown, I think, back, and I think Pamela was there, and probably some of the other folks, when we were at Mass General back about a year ago, almost a year ago now, where the governor sent his records from Boston to Springfield in just a matter of a few seconds. That aspect will be available to everyone ultimately as the system is fully implemented, and be able to get that kind of very critical information that can in fact save lives and certainly can save money in the process. So I'm particularly pleased to have played a role in that in the Chapter 58 of 2006. Further changes in 2008 and 2010 and 2012. We keep refining it and improving it and expanding it. And to have played a role in the creation of the eHealth Institute of MeHI, and placing it within the Technology Collaborative, who I believe has done an outstanding job, and who the legislature believes has done an outstanding job in the management of these funds. So it's been a great partnership. The traditional public-private partnership is really the way the government ought to work to help improve the lives of the people that we serve. So it's now my pleasure to introduce the congressman for this district, for Milford and some smaller communities to the east and south. Not particularly consequential. He may think so, but I don't have to think that. Other than Bellingham, of course, which is important in this area. But Joe Kennedy has really hit the ground running as a member of the House of Representatives. And it's too bad that the 434 others aren't as helpful and as good as he is, because we'd get a lot done nationally, but at least we're fortunate enough to have an outstanding new member of Congress representing this part of the Commonwealth, and one who I know is going to go on and do some great things, but has already been doing a lot of great things. And we're so proud that he's our congressman for this area, Joe Kennedy.
Senator, thank you for the extremely kind introduction and for the incredible leadership that you have shown here in Massachusetts and across our country. I will tell you from now being down in Washington for the past 6 or 7 months or so, all eyes with regards to healthcare reform have been on Massachusetts, and if you're focused on Massachusetts, your eye on healthcare reform, your eyes are on Senator Moore. And your leadership, what you've done in this state, how that ripples across our entire nation and our country. It is a extraordinary achievement, and in my mind is really and truly the embodiment of what public service is supposed to be all about. And so, Senator, you set the bar incredibly high for the rest of us, and it is a privilege to be able to serve with you. So thank you very, very much for all that you do. It is great for me to be back at Milford Regional Medical Center and to be standing with a number of good friends who we spent the morning with again as well. Frank, thank you. Thank you for all you do. Thank you for your friendship. Thank you for having me back. Thank you for the leadership that you show, not just here, but throughout the entire region. And a shining example of the very best of the ways that medical center can deliver care. Your commitment to this community continues to set the example, and I'm glad that your hard work is being rewarded today. I wanted to thank Representative Durant as well, and a very dear friend, speaking as a former prosecutor. You always have to recognize the judge in the room. So, Your Honor, it is a privilege. It is a pleasure, always. Thank you for being here, Judge. Thank you for your friendship. Thank you for your mentorship, and thank you for your leadership. It's good to see you again. Just want to take a very quick minute and recognize Massachusetts eHealth Institute and Mass Tech Collaborative for their leadership in advancing technologies that improve the quality and efficiency of healthcare in the Commonwealth on a daily basis. The Institute is a dynamic link between stakeholders in public and private sectors that care and are deeply committed to our Commonwealth's healthcare system, and our entire state is better for it. So thank you for all the extremely important work that you do. To everyone here at Milford Regional, as well as the community partners here in the room, congratulations on grant money that is so unbelievably well-deserved. For decades, the Milford area has been a bright spot for our state's healthcare system. From hospitals to nonprofits to advocates, doctors and patients, this area has worked together tirelessly to ensure that patients across the Metro West area receive the best quality care. It's no surprise to me that when the eHealth Institute was looking for facilities to help promote and the innovative healthcare information exchange network, they landed here in Milford. These generous grants will help catalyze the efficiency across the state and help providers deliver the highest quality care to patients all over the region. As our country continues to move forward in the challenging process of implementing a historic and complex project of comprehensive healthcare reform, innovation and cooperation at the local level are more critical than ever. No one in Massachusetts needs to be told, but the advancements at the local level are the ones that are going to fuel change across this country. Our state has always, always led the way when it comes to healthcare, thanks in part to so many of you in this room today. So with this announcement, you once again prove that it is our Commonwealth that is going to show the rest of the states how we get it done. Thank you so much. Thank you for including me, and congratulations once again.
Well, I have the pleasure of introducing the team from Milford Regional Hospital, and I'm pleased that Nicole Heim, the Chief Information Officer, is going to be the leader here because she does all the real work. Ed and Frank just kind of there for the photos, but Nicole does the real work, and again, anybody who understands computers is really important in our world today, and Nicole is the best. So Nicole, if you could come forward here, and the grants. Actually, Milford is receiving, there are a couple of grants, I believe, but it's primarily focused on cementing the relationship, in this case with Medway Country Manor, and also the home health agency that serves this area. And we'll see that, I'm sure, over time, develop to all of the skilled nursing facilities. I see Beaumont represented here prominently, and I don't know where Frank is for Blair House, but He's usually at any photo op too. But I'm sure the other facilities, it's so important that you do this and that you can make that kind of connection. So, Nicole, I'm turning it over to you.
Thank you.
And Pam will give you the money later.
Excellent. Look forward to that. Thank you all for being here. Appreciate you coming to Milford. And we appreciate this opportunity to join the highway through this grant opportunity. And I'm going to go through a little bit about Milford. Just so you know, we are a full-service community hospital, 121 beds, and we serve 20 communities. And this is us in the middle. Not everyone's aware of how many communities we serve here in Milford. Why did we decide to join the highway? Well, it supports our efforts to reduce readmissions. We have done a number of things, including the formation of an interdisciplinary patient-centered transitions team, looking at patients' actual studies and looking for opportunities to improve communication between Milford and the outpatient settings. And we're also an active member of the state action on Avoidable Rehospitalization Initiative, the STAR initiative. So the decision to join the highway was an easy one. It supports these efforts that we have already taken up. So, I wanted to illustrate what our use case here is for the highway using a patient example from one of these studies that we had done here at Milford. So this particular patient was admitted here 11 different times over a course of a year to include 58 hospital days. So if you can see, this is a cycle of from home or assisted living, a SNF, or even surgical patients coming here to the ED, getting admitted, discharged, and so forth. And this cycle could happen. In this particular case that was studied, that's what happened and why. So we'll look. The number of providers, this is staggering, how many providers this patient had involved in their care over the course of a year, and you can see the numbers, and how many studies were done. 54 studies and 24 chest x-rays over the course of the year. And then after discharge, a number of providers, again, assumed care for this patient, including primary care physicians, family members, skilled nursing facilities, visiting nurse, home health care. And why does this cycle continue? Well, what we found were that printed discharge summaries and the instructions that we actually give those patients were often misplaced, and they didn't travel with the patient and given to the next care provider to continue that care. And to continue the teaching that we did here at Milford, we gave those instructions, but they never followed the patient. So the patient came back for multiple admissions over the course of the year. So our use case for the highway was to provide that documentation electronically to those facilities and organizations that will assume care for the patient upon discharge. And then, of course, we want to receive information from facilities upon admission right into our Meditech EHR. So that's our use case for the highway. And now I just wanted to recognize the huge team that's involved in this grant. So if you want to stand up. We include people here, for staff here at Milford, staff from Medway Country Manor, and care tenders. If you want to just briefly stand up so you can see who's involved. Thank you. So one of our partners, Medway Country Manor, is a privately owned skilled nursing center. And over the course of 2012, had 289 admissions and 280 discharges from Milford. And then Care Tenders is a VNA that we chose to partner with. And the reason why we had chose them, they were involved in these other initiatives, and they agreed to be a partner of ours to start this pilot program with the highway. And so we're excited to work with the two partners. And the goals for this project to continue that work, to reduce the avoidable readmissions and to improve that communication between us and these facilities, these organizations, and to assist the families because they don't always remember to bring that documentation to the next organization. So if we can deliver that electronically, we're going to improve that communication. And here at Milford, we're in our year 3 of stage 1 meaningful use. For those of you who are familiar with meaningful use, we're very excited that we've been able to attest for the last 3 years, and we'll move on to stage 2 meaningful use starting here in October, and we're looking at using the highway as part of our strategy to meet those initiatives, those objectives for Meaningful Use Stage 2, which will require us to send electronically that documentation upon discharge. So we're excited. And here I'm going to leave you with a little graphic of us here, Milford Meditech, and we're going to exchange data through the highway to these organizations that we talked about. Other organizations have agreed to partner as well with us, and then there's endless possibilities of other partners to expand. And that's the point of the highway. Through this grant program that we're fortunate enough to receive, we're piloting with these two organizations, but our goal is to continue this this connection with multiple other facilities and organizations that are going to care for our patients on discharge. So we're definitely excited to start this project and be on the pioneer end of the highway and share our story with other facilities that will come after us. So that's it. So thank you again for coming. Sorry.
That's okay.
I'm sorry.
That's okay, Nicole.
He's used to a much more flowery.
No, I actually, as a member of the Republican delegation of the Massachusetts House of Representatives, I'm more familiar with being ignored. So that's, don't worry about it. It's not a problem. Ba-dum-boom. All right. So I'm very happy and honored to be here at Milford Regional. The one end of Senator Moore's district. I'm actually from the other end of Senator Moore's district, out in the Southbridge, Charlton, Dudley area. But today, I'm very happy to be here and to congratulate the Overlook Masonic Home VNA for receiving this MeHI grant. It's a wonderful facility that's doing fantastic work out in our community. And we're fortunate in southern Worcester County to not only have an outstanding community health care options that are available to us that have been improving the delivery of health care services to area residents, but also systems and agencies that can collaborate to advance that care to a new level. The partnership between Overlook VNA and Harrington Hospital is just such an example. Both of these facilities are standouts and shining examples of the quality of care available in Massachusetts. And from a personal note, they're both in my district, so they make me look good. In today's society and business world, the use of technology has advanced at incredible rates, gone from simply being a convenience to an absolute necessity. Electronic medical records promise to improve efficiency, accuracy, and lower costs, but getting there, as we spoke about a little bit earlier, isn't necessarily an easy task. The MeHI grants help speed the process of getting there. And the Mass Highway is a perfect example of how we can use cutting-edge technology to improve the lives and the health care services of everyone here in Massachusetts. This grant program shows the continued dedication of the Commonwealth for the health and well-being of its residents and for the health care providers who are the true heroes in any healthcare system. So I'm here to introduce Kathy LaRocca. I almost said LaRocca. Where's Kathy? There you are, over here. Kathy LaRocca, the VP of Fund Development for the Masonic Healthcare System. Kathy? Thank you.
Thank you very much. Thank you, Representative Durant. And thank you, Congressman Kennedy, and especially Senator Moore. As a proud graduate of the State School of Public Health, we know you as the champion of public health for many years, so thanks for doing this again. We're very excited and pleased to be the recipients of this grant. I need the clicker. Oh. So we are, once again, Nicole, thank you for all of the examples that you made about the dangers of rehospitalization, and you've made a great example. So we are also aiming to reduce rehospitalizations by streamlining discharge to home care admissions. Masonic Health System is a continuum of care, which includes Overlook Visiting Nurse Association, which is also now known as Overlook Care at Home. Our mission statement, which is kind of small there, empowering individuals to realize their potential in the communities where they live and work. When people ask me what Masonic Health System does, I say we're trying to revolutionize the care of elders in this country and the perception of aging. And that's exactly what we're trying to do, to keep people as independent and strong for as long as possible in their own homes. We are a healthcare continuum. We include independent living on our campus in Charlton, skilled nursing facilities in Charlton and Northampton, a post-acute unit in both skilled nursing facilities, outpatient rehab in Charlton, and home care and hospice, which includes 8 locations across Massachusetts and 4 hospice locations. Our base is in Charlton, which is strategically located very close to Harrington Hospital. We also have a case management system called CARE, which does case management referrals for families of elders who are concerned about what the next step is. Harrington Hospital is a community-based hospital serving 27 communities in southern Worcester County and northern Connecticut. It's a 114-bed acute care hospital with satellite medical facilities across central Mass. And we have a long-standing, 100-year relationship with Harrington Hospital. When we were a little Masonic home 102 years ago, and Harrington Hospital was a small community-based hospital, we were exchanging patients and resources then. So it's a perfect fit for us to be partnering with Harrington Hospital in this endeavor. At this point, I want to introduce our partners in crime, 2 of whom are off having fun. The CIO of Harrington Hospital and our Vice President of Information Technology are having a lot of fun outdoors. But we have our partner representing Harrington Hospital is Lauren Josie, who is the Director of Applications for Harrington Healthcare. Lauren, and Patrick McShane, who is our Vice President of Communications and Marketing for Masonic Health System. So our project is very simple and probably a no-brainer. Replace the current paper admissions process with seamless electronic transfer across the Mass Highway. The current system includes a physician writes an order, it gets transcribed, our care liaison picks that up, transcribes it again, faxes it to a branch office. That branch manager submits it to a clinician who then calls the patient and goes out and does the first assessment and visit to someone who's been discharged from Harrington. So if you've ever played that game called Telephone, it's very dangerous sometimes when you whisper something into someone's ear and 10 people later it comes out as totally something different. Hand transcribed orders can do the same thing. So there is a risk of error. What we plan to do now is for the discharge orders to go directly from the physician, entered once, seamlessly streamlined across the information highway to a home care clinician's tablet. So that clinician who's on duty gets the information in his or her tablet, contacts the patient, makes the meeting, goes to the patient's home, and does the assessment and the intake. We're hoping to get discharge to intake to less than 24 hours of hospital discharge. Our goals are to reduce the time between patient discharge and admission to home care, discharge the orders to home care clinician tablet, providing all of the necessary information for home care admission in one place. So all of the orders and the patient history will be in that one place, giving the clinician everything they need. Reduce the error by eliminating the need for rewriting and reinterpreting physician discharge orders. And improve the patient outcomes post-discharge through prompt and continuous care. Everyone knows who's been in the hospital that it's not a fun place to be. The fact is that you can't wait to get home and sleep in your own bed. Even when you're traveling on the road, you can't wait to get home and be safe and where you're comfortable. So the one thing we don't want is for people to come back to the hospital, God forbid, 11 times. We want it to work once. We want to provide the best patient outcomes and the best security, because people don't do well in the hospital. I mean, once the initial situation is over and stabilized, we want to get them home safe, get the care and the support that they need. We want to reduce costly rehospitalizations, and it's not just monetary costs, it's human costs. Especially in this case of a vulnerable elder, they are most comfortable in their own environment. If you rehospitalize, they have more risk of infection, confusion, and people just don't do well going back into the hospital. And it's really not what the hospital wants. You want to take care, it's an acute care place, you want to take care of acute stuff. You don't want to have rehospitalizations. You want it to work once, if possible. The unexpected outcomes that we're finding now are there new dialogues springing up between Harrington and Overlook in many different ways, not just in the home care area, but also in our post-acute unit and in our skilled nursing facilities. How else can we communicate information to improve patient outcomes in those areas of our system? So there are a lot of great possibilities. We are having meetings and discussions about seamless translation of other information across the system. So it's really opening up a lot of dialogues that we didn't even expect. It's a great opportunity. So we're hoping that improved community-based care equals improved outcomes where patients live and work. So once again, we're very grateful and look forward to working with this grant. Thank you.
So I think that, what I'm most excited about is, the projects that Nicole and Kathy highlighted show how we're really focusing on keeping care in the community. We're keeping care from community hospital to, discharge out to the home and to the supporting organizations and healthcare providers that can keep people, hopefully get them better, but at least keep them out of readmissions, out of hospitals, and really deliver care in a setting that they're comfortable with, as well as care that's most cost effective and highest quality for the patient. So, these are 2 out of, as I mentioned, 32 grants that are kicking off now. Kathy, I thought, had great examples of what we had hoped would happen are unexpected but hoped for outcomes of additional communication, additional ideas that are being sparked by these collaborations. That a little bit of grant money, while it's significant, really is only a piece of the project, and that all of these organizations have committed to moving this forward. So we've got a couple of minutes for questions of the grantees or of MeHI if you have questions about other of the grants or any of the items that have been brought up today. So I don't know if folks have questions out in the audience. I think this is an audience that probably knows a lot of these grantees, knows some of the projects, is excited to be getting back to their day jobs on actually making this happen. So as I pointed out to Nicole, I'm really looking forward to, they're talking with the Manor Home and then the other community partner here, but then they're going to start to leverage that same connection. And I saw a list of 3 immediates with UMass and Reliant and partners, and 6 future nursing homes. So we've written all those down. They're on our opportunity list, and we'll be working with you to call them to bring them onto the highway as well, because this is really, it's a network effect, right? As more and more people join the highway, the power of that network increases with the square of the number of participants on that network. So we're really excited about getting this going. Thank you all very much. Thank you very much, Frank and Milford Regional, for hosting us. Senator Moore for your leadership in pushing this forward. Representative Durant and helping to encourage health reform across the Commonwealth. And Congressman Kennedy left us a little bit early, but we'll forgive him that, and he will. He said that whatever we needed in terms of e-health, he's going to push for in Washington as well. So thank you all very much for coming today, and we look forward to giving you sort of towards February and even earlier the midterm reports, as well as the final outcomes of the grants, because that's a key piece of this, is to measure these outcomes learn from this and encourage organizations to work on similar sorts of projects. So thank you very much.